Hi, I'm Patty Durrell, the CEO of Rock Solid Fitness and a licensed physical therapist assistant. And I want to show you some stretches today that you can do if you have chronic low back pain, or if you're just at home sitting a lot, which I hope you're not, or you have a sedentary kind of job where you might be in front of a computer all day. So these are great stretches that you can do. All you need is a floor and maybe a mat or a towel. So let me show you first, if you do have chronic low back pain, the proper way to get down on the floor, okay? So you wanna kind of approach the floor like you were going to get on all fours, because that's exactly what you're going to do. So you can come down on your knees first, then come down on your hands. You're gonna get all the way down onto your belly, and then we call this the log roll. You're gonna roll over onto your back like one unit. Good. And now, once you're on your back, I want you to bend your knees, especially if you have chronic low back pain, because with your knees bent, that takes the pressure off of your spine, okay? So the first stretch I'm going to show you, we call double knees to chest. It's also a great glute stretch. So you're going to grab behind your knees, never in front of your knees. That could kind of strain your collateral lateral ligaments, which are the ligaments that run on the side. So always on the back side of your thigh, and then just kind of pull your knees into your chest. I like to think of it as like giving yourself a big hug. And when you're stretching, there's lots of controversy out there about how long you should hold a stretch, 30 seconds, a minute and a half. I just say the rules are no pain, no shaking, and hold the stretch until you feel yourself relax into it. Once you're done with double knees to chest, you can go ahead and do single knee to chest. So you want to make sure that one leg is straight when you do this. Then you're going to, again, grab behind your thigh and pull that knee into your chest. Now, if you feel this leg rise off the floor, that means that this muscle right here, called your hip flexor, is tight. So I'm gonna show you what to do for that as well. I'll show you a hip flexor stretch. But for now, you're gonna do just a single knee to chest and hold that. And then of course, you can't forget about the other side, right? From here, you can move right into a hamstring stretch. Now, tight hamstrings are always a culprit of low back pain. They kind of make your pelvis tight and it doesn't allow it to move, so it will cause low back pain. Now, what healthy range of motion for your hamstring is when your hip is at about 90 degrees, okay? I have met people whose hamstring length is way down here, and as much as they stretch, it never gets better. It's just how they are. And most of them have low back pain. It's still important to make sure that you stretch that hamstring muscle, even if it's tight. And if it's that tight, a little trick you can do is take a belt at home. This happens to be a gait belt we use in physical therapy, but you can use a regular belt and kind of cinch it up, or even a dog leash works. You can put it at the end of your foot and use the strap to lift your leg up. Again, you don't want any pain or shaking, and the tighter your hamstrings are, the more pain or shaking you might feel, okay? So after you're done stretching the one side of your hamstring, you can't forget about the other side, okay? So stretch the other side as well. After your hamstring stretching, a great stretch that I love to share with people is called your piriformis muscle stretch. The piriformis muscle runs in the back here, and the way to stretch that is to just cross your ankle over the opposite knee, grab with the opposite hand, and pull that knee toward the opposite chest. You should feel a good stretch right here in the base of your gluteus or your butt muscle, okay? And again, you want no pain or shaking, and you want to hold that, right, until you feel yourself relax into it. A lot of times you can just feel that kind of tension go away in your low back, your sacroiliac joint, which is that little dimple in your back that you see sometimes on other people, right? So then, of course, you can't forget about the other side. You must do the other side. And then to open up the opposite muscles, or the internal rotators of your hip, you would just take your hand and keep your ankle on the opposite of the knee and just push your knee away from you. If you can't get a stretch, you could pull that leg closer to you and then push away. You don't want to let your whole pelvis and body rock. You want to keep yourself straight as you stretch that hip. Again, no pain or shaking, and hold it until you feel yourself relax into it. And then you can't forget about the other side. Now the next one I'm going to show you is called trunk rotation. And this many people just love this exercise. It's almost just a great thing to do before you get out of bed. I tell people to put their hands up toward their ceiling and bend their knees, and then just let your arms drop to one side and your legs to the opposite side. And you want to try and relax in that. And you're going to feel a great stretch up your back here. And then, of course, we can't forget about the other side. I just got a little adjustment as I did that. So I remember telling you that if your leg was pulling off the mat, right, or the floor when you're doing your single kneaded chest, if you find this is happening, it means you have tight hip flexors. So just like the hamstrings are culprits for low back pain, if you have tight hip flexors, you're going to have low back pain also. The reason being is that muscle that runs up here attaches to the front part of your lumbar spine or the low part of your back. And so when it's tight, it makes your body do this, and it puts a strain on your low back and can cause pain. So the way you stretch that is you roll over onto your belly. Sometimes people feel a stretch in their hip flexors when they come up on their elbows like this and just keep their hips down. You might even feel a pull on your low back, right where that muscle attaches to your spine. If you feel pain, you need to come out of that stretch, okay? And you might want to just try to bend your opposite knee, and you'll feel that stretch in the top of your thigh. Again, if they're really tight, you're going to feel low back pain. Remember, the rules of stretching are no pain and no shaking. So again, sometimes it's hard for people to grab their ankle and pull that stretch in. I'm extremely flexible. I have no problem with that. But if you do, you can use that same dog leash or belt, and you can just wrap it around your toe. And again, you can use this as a little prop. And sometimes people have stretch straps. You can use a stretch strap as well and do it like this. Now, if you really want to increase that stretch because you don't feel it, you can do both. Come up on your elbows and pull that in. But we can't forget about the other side. Now, if you have chronic low back pain, it's important that you get off the floor the way you got on the floor. So I'm going to ask you to make sure the straps are out of the way so you don't trip on them. So you'll come back onto all fours the way you started, and then you're going to come up onto a half kneel or a kneeling, and then a half kneeling, and just push yourself up. If you need help, you can help yourself up. And there are some stretches to help with low back pain or tight hips, or just to go through if you're sedentary. I hope that helps you. Patty Durrell from Rock Solid Fitness. Thank you.